So thank you for logging on if you are here and joining us for the Empowered to Know Your Numbers, How to Measure, Manage, and Understand Your Blood Pressure discussion we'll be having this evening. My name is Chelsea Walzak-Burks. I'm with the American Heart Association in the San Diego region here. Very excited to have you this evening and to help host and present this discussion in partnership with the San Diego Black Nurse Association and locally sponsored or locally brought to you by San Diego Gas and Electric. I'm really excited to introduce our main presenter and content expert for this discussion this evening, Samantha Williams. Samantha is a family nurse practitioner with over 15 years of experience in nursing. Her career focus has been primary care with an emphasis on wound management, community health, palliative, and cardiac care. She's deeply embedded in serving the community through her roles with the San Diego Black Nurse Association. She's the chair for both the COVID task force and their flu clinics. And she also sits on numerous county-wide advisory positions where she can share her expertise in both nursing and as well as equity. Thank you so much, Samantha, for lending your time and expertise to us today. We're very glad to have you. Before I hand it over to Samantha, I'm going to go ahead and run through a quick overview of today's discussion just to get us started. Today, during our discussion this evening, we will be covering the basics around blood pressure. What is it? What are the measurements and the categories? Understanding the significance of blood pressure on your overall health, as well as learning the factors that contribute to high and low blood pressure and how to make small changes that will move you towards control of your blood pressure. And then finally, understanding the best way to get an accurate blood pressure reading at home. In this first section, we'll cover the basics, what is blood pressure, the measurement of blood pressure, and our blood pressure categories. But first to kick this off, just going to give a little bit of general background before we jump right into blood pressure and talk about cardiovascular disease. Cardiovascular disease remains the #1 killer of both men and women. And it's one of the most expensive diseases, costing nearly $1 billion a day in medical costs and lost productivity. High blood pressure, it's the preventable and treatable silent killer, is second only to smoking as the leading cause of heart disease and stroke death. The old time adage, an ounce of prevention is worth a pound of cure, is particularly apt when we think about blood pressure, since we know it can really help lead to the prevention of heart disease, stroke, and so many other diseases. So I'm going to jump into our next slide and introduce and allow Samantha to come on to really lead our discussion. So thank you so much, Samantha.
Wow, Chelsea, $1 billion a day. That is astonishing. So happy to have everyone join us today to talk about blood pressure. So I'll go ahead and jump right into it. And Chelsea, thank you so much for that beautiful introduction. So blood pressure, what is it? So blood pressure is the force of our blood pushing against blood vessel walls in our heart. This cycle begins in the ventricles of our heart, which are 2 chambers in the bottom, in the lower portion of our heart. And as that pressure courses through those blood vessels, which are our arteries, arterioles, and capillaries, it affects how good or bad they work. Understanding how the heart and the blood vessels generate blood pressure is really important, as it helps us understand how high blood pressure can have a negative impact on our health. So if you take a look at the picture, take a look at the picture on the right side of it, it has 3 examples of blood vessels. And you see you have we have an example of an elastic artery, a muscular artery, and an arterial or capillary. The main obvious difference that you can see with these blood vessels is the size of the lumen. And the lumen is that middle portion of the blood vessel, which is where the blood circulates. And of course, our actual blood vessels are much, much bigger. much longer than this, but these are just dissected pieces for us to look at. So we have these blood vessels throughout our entire body, supplying all of our organs and tissues with blood, like our heart, our brain, our kidneys, even our eyes, all throughout our body, everywhere you can think of, because our body needs circulation to live. And when your blood pressure is consistently high or too low, it really has an effect on these areas, especially those vital organs. So as we go to our next slide, it'll give us an example of, again, an example of our heart and what those blood pressure numbers look like. With every beat that the heart pumps blood into those large blood vessels of our circulatory system, as I mentioned, the blood moves throughout the body and it puts pressure on those walls of the vessels. And that pressure is measured in what's called millimeters of mercury, which is represented in the picture as the mmHg. As our blood pressure rises and falls throughout the day, when we take our blood pressure with a blood pressure monitor, it gives us readings. And those readings are made up of two values. The first value that we will talk about is our systolic blood pressure, and that's the top number, 117. That's the pressure that's exerted when our heart beats, which essentially means that's the amount of pressure in our arteries during each contraction of our heart muscle. So while the heart muscle is contracting or squeezing, it's pumping oxygen-rich blood throughout our blood vessels. And that bottom number is called the our diastolic blood pressure. And that number, which is 76 on this picture, represents the pressure on the blood vessels when the heart muscle relaxes in between beats. And at that time, the heart is quickly refilling with blood before the next contraction. And the diastolic pressure is always lower than the systolic pressure. On the next picture, this is a nice picture of what those categories look like in terms of our blood pressure ranges when we consider them normal, elevated, high, or even hypertensive. And this slide is definitely important. It gives us categories of our blood pressure readings. And so if your blood pressure is in normal range, you'll probably hear a doctor say something along the lines of congratulations on having such a good blood pressure. Your numbers are well within normal limits. And that means that they are less than 120/80. Your doctor probably say, keep up the good work and stick with some of those heart healthy habits that we've talked about. Moving on to the next category is elevated. And if your blood pressure is elevated, that means your readings are consistently ranging from 120 to 129, and your diastolic is less than 80. Now, that's not the end of the world. However, we do know that through research, people with elevated blood pressure are likely to develop high blood pressure unless certain steps are taken to control it. The next stage is hypertension stage 1. And that's when the blood pressure is consistently ranging from 130 to 139. And your diastolic is about 80 to 89. So at this stage of high blood pressure, your doctor is likely to start talking about implementing some lifestyle changes, maybe even considering adding a blood pressure medication. It's all based on your risk factors. There's a score that providers look at, and it's called your Cvd score. And that stands for Atherosclerotic cardiovascular disease. That score provides doctors with a prediction value of how likely you are to have a heart attack or a stroke within the next 10 years. Some of the things that are factored in with that risk score are things like age, race, gender, blood pressure, cholesterol levels, smoking history, things along those lines. And those factors those things are factored in because research shows that based off those factors, everyone's risk may vary. So it's not a matter of fact where you use the same for everyone, but based off those risk factors cumulatively, it gives us a predictive value. The next stage is hypertension stage 2. And that's when the blood pressure is consistently ranging from 140/90 and above. And at this stage, if your doctor hasn't already, they are likely to prescribe a combination of blood pressure medication along with some of those lifestyle changes. that we'll talk about a little bit later on. The last stage is hypertensive crisis. That's the stage that none of us want to be in. And this is when the high blood pressure requires medical attention. If your blood pressure readings suddenly or consistently are exceeding 180/20, that's the problem. And it's unusually high. You need to contact your doctor immediately. And if you're already at the doctor's office, or when you do contact your doctor, they'll ask you, what are you experiencing any signs or symptoms? And if you are having signs and symptoms of shortness of breath or chest pain, back pain, numbness or weakness, changes in vision, difficulty speaking, then they'll probably tell you to hang up the phone and call 911 immediately. And if you're at your doctor's office, they'll go ahead and do an assessment on you. And if they feel that it's necessary, they'll call 911. And moving on to our next slide, we'll talk a little bit about why it's so important to check your blood pressure. 1 second. And so there's no specific number at which day-to-day blood pressure is considered too low, as long as noticeable signs and symptoms are not present. And this slide is really important, and I'm glad that we actually have it in here, because this slide is discussing low blood pressure. And oftentimes, we don't talk to our patients enough about low blood pressure. We focus so much on high blood pressure that when patients or community members start to experience symptoms of low blood pressure, they're not sure of exactly what's happening. And so when your blood pressure is chronically low, it becomes most dangerous when it causes these noticeable signs and symptoms like dizziness, nausea, fatigue, fainting, dehydration, which you'll know you're experiencing because you're feeling thirsty a lot, lack of concentration, blurred vision, and even sometimes cold, clammy, or pale skin. Those are the most common signs and symptoms. So this is really important to discuss here, as well as when you're at your doctor's office, if you're experiencing any of those signs and symptoms. And this is especially important for our elderly population. Oftentimes when you're elderly, you're smaller and you have less body mass in terms of the amount of muscle and tissue, or what they say, as they say, more cushion for the pushing. And so when you have less cushion, and research shows that you're at increased risk for a fall. And depending on where you fall, it can definitely be more severe. And so a lot of those factors come into play when a person that is elderly is taking medication. And so although providers have checks and balances in place when they're prescribing medications to our elderly population that affect their blood pressure, there are so many factors that can change that effect that medication has on the body. It can easily be missed sometimes. And so again, if you're frequently experiencing those signs and symptoms, make sure you report those to your doctor. And there you go.
Thank you so much, Samantha. I think that's great. And I love that you gave us a really great dive and overview into blood pressure in general, a little bit about high blood pressure, about low blood pressure. And in this next section, we're really excited to have you take us through the impacts and outcomes associated with blood pressure. You know, why does blood pressure matter? And also take us through the risk of uncontrolled blood pressure.
So this slide is reminding us of how often high blood pressure can be a silent killer, like you mentioned earlier, Chelsea. Nearly half of adults in the US have high blood pressure, and very often there are no obvious symptoms or signs that they have high blood pressure. Studies actually show that only about 1 in 4 adults with hypertension have their blood pressure under control. So with this slide, paying particular attention to the red blood vessel, this picture is showing us the lumen of that blood vessel, which is the inside of those blood vessels that we were talking about earlier, your arteries and your capillaries and arterioles. And so when the pressure is too high, it stretches the blood vessels and causes them to get these small tears in the tissue. And those tears, like any other sore in or on our body, can become red and inflamed, and that starts to create scar tissue. And when that happens, any plaque or infection-fighting white blood cell, or even a waxy cholesterol, can get trapped in the scar tissue, which then forms buildups or blockages even within that blood vessel. And when there's a blockage, that's really, when there's a blockage in a really important artery, or when that buildup dislodges, we really put ourselves at risk for a heart attack or even a stroke or some other cardiovascular event. So the key takeaway here is that high blood pressure is dangerous. It can really start a domino effect of uncontrolled high blood, it can start a domino effect. And with uncontrolled high blood pressure, that can lead to vision problems, kidney problems, a heart attack, and even heart failure. So keeping your blood pressure within normal range, it's not just about saving lives, it's also about preserving the quality of your life as well. And on this next slide, this is really getting into the weeds of what we were just talking about, right? Talking about uncontrolled high blood pressure and what that does to the body. So kind of just starting from the top and working our way down in the brain, having a high blood pressure causes those blood vessels in the brain to either burst or clog more easily, and that can lead to a stroke. Looking at the eyes, high blood pressure definitely puts strain on those blood vessels and damages them, and ultimately affects your vision. A person can even go blind with having high blood pressure consistently for too long. In terms of the heart, we've kind of already talked about that a little bit, but it definitely increases the workload when you have high blood pressure, and it can even cause the heart to enlarge, which in turn would fail to supply the body with, fail to supply the rest of our body with the blood that we need, right? If your heart is enlarged and it's not functioning properly. We already mentioned that it can cause a heart attack because it's damaging those arteries and they can become blocked, or even have something to get stuck and then dislodge. It can cause kidney disease. High blood pressure is damaging to all the vessels throughout the whole body. And when it's attacking the kidneys, it's interfering with their ability to effectively filter the blood in your kidneys. Some don't know that it can even cause sexual dysfunction. In men, it can cause erectile dysfunction. And even in women, it can cause a lower libido. Even though you can't see the bottom of the slide, it's showing how high blood pressure consistently can cause what's known as peripheral artery disease. And what stems from that is something called atherosclerosis. And that stems from your blood pressure being too high and starting to mess with some of those arteries in our peripheral extensions, like our arms and our legs, and it causes the arteries in those places to narrow, and it can even cause pain and fatigue in your arms and legs, in your stomach, in your head, and things like that. And moving on to the next slide, here we'll talk about some non-modifiable risk factors. And although there are some things that we can modify, there are some things that we can't. And so some of us have some of these factors that we can't change, like family, age, gender, and race. Now, historically, it's known through research that African Americans in the US have a higher prevalence of high blood pressure than any other racial and ethnic group. And that's for a variety of reasons, but we won't really get into the weeds of that. Now, since this is February and it's Wear Red for Women Month to bring awareness about heart attacks and strokes in women, I'll just give you a few facts about blood pressure, cardiac health in regards to women. So about 50 million women in the US have hypertension, and more than 30% of cardiac events in women are due to hypertension. Another quick fact is the fact that more than half of the deaths from high blood pressure are in women. And lastly, studies even show that hypertension rates in women are expected to double in the next oncoming years for women under the age of 45.
Thank you so much, Samantha, for sharing that, and especially for highlighting the Go Red for Women movement and really focusing on women's health as it comes, as we're thinking about cardiovascular disease and blood pressure. We know our women are always taking care of their mothers and their caretakers, and they're taking care of others, but we always want to make sure we shine a light on taking care of themselves and focusing on their health too.
Definitely.
So as we jump into the next section, we're going to talk about this change in control component as it relates to blood pressure. So we're going to have Samantha talk through the behavioral risk factors. You just heard her talk through the non-modifiable risk factors, but there are some things that we can modify. So we're going to talk about behavior. We're going to talk about why self-measured blood pressure is important. And then we're going to talk through how to accurately measure your own blood pressure at home, so outside of your healthcare provider's office.
Thank you, Chelsea. So as you mentioned on a few slides ago, I talked about some of the risk factors that we can't change, right? Like gender, age, race, and family history. So real quickly with this slide, we'll just talk about some factors that we can change. And then there's another slide after this that we'll talk about, that we'll go more in depth. So with this slide, as you can see, things like our physical activity, our diet, managing our weight, how high or low our cholesterol is, things, conditions like diabetes, stress, alcohol intake, and even smoking. Those are all risk factors that we can change. And moving on to the next slide, we'll kind of go into the weeds of some of these things that we know we can change. And so these are important factors to talk about your doctors, to talk with your doctors about. The greatest impact that a person can have is really focusing on some of these factors that we can change. And I like this slide in particular because as we speak about some of these things, it even tells you how much your blood pressure can actually go down if you were to implement some of these lifestyle changes. So managing weight, if you're overweight, even losing a little bit of weight can definitely cause a reduction in your blood pressure. It can bring that down about 5 millimeters per mercury. So if your blood pressure is 145 over 85, then you can possibly bring it down to about 140 over 85. And then with more weight reduction, bring it down even a little bit more. And of course, if you are able to, the more of these things that you're able to implement, the greater reduction on your blood pressure that you can have. So other things in regards to your diet, you definitely want to eat smart, and you want to eat a heart-healthy diet full of vegetables, fruits, whole grains, beans, plant-based proteins, lean meats like chicken, and even fish is really good for you. And you definitely want to limit your salt intake and limit the amount of saturated fats that you take in, like oils and butter. And you also want to limit the sugar, decrease your intake of sodas and other sugary drinks. I think we all know that physical activity is a big one. We all need to move around a little bit more, especially in this pandemic. So physical activity is major. It helps control not only your blood pressure and your weight loss, but even your levels of stress. Smoking, that's another big one. Smoking, vaping, any tobacco use over time, it raises your blood pressure. And not only your blood pressure, but your heart rate as well. And the effect that it has on your vessels is that it narrows those arteries and it hardens the walls within those arteries, and it makes your blood more likely to clot. We mentioned sleeping was mentioned on the last slide, but I just want to point out how important getting enough sleep is as well. Not getting enough sleep, which would typically be less than 6 hours, or even getting poor quality sleep, that's also associated with high blood pressure. And so you definitely want to make sure you're thinking about those things. Other things like reducing the amount of alcohol that we consume, that helps to reduce our blood pressure as well. And lastly, it's important to mention that when we have other conditions like diabetes, you're having the same effect on your organs, right? You're damaging your organs just through a different mechanism of action. And so things like diabetes or high cholesterol, it's just exacerbating some of the damage that you're already doing. And it can cause those organs to fail even quicker. And so for some people, lifestyle changes are sufficient to control their blood pressure. And so for others, they are not. And so that's why it's important to implement these changes. And if necessary, if your doctor prescribes medication, make sure that you're taking it as prescribed. Whichever the case, we need to do the best we can to adopt these lifestyle changes and monitor our health and adhere to those medication that's prescribed. And so moving on to the next slide, in this slide, we really begin to discuss how important it is to take our blood pressure. Okay, it's extremely important that we are taking our blood pressure at home for ourselves. So there's such a thing as white coat syndrome or masked hypertension. With white coat syndrome, typically when you go into your doctor's office, your blood pressure is just it's increased. And so that may not be your baseline blood pressure, but it's increased it can be increased for a variety of reasons just because you go to your doctor's office. And so we don't want to depend on that number. Same thing with the opposite, which would be masked hypertension. It could be possible that oftentimes when you go to your doctor's office, your blood pressure isn't that high, but then there may be times throughout the day at home where your blood pressure is high. It's important that we know what your normal baseline is. So taking your blood pressure at home allows us to know what your baseline is. And I just want to add too that oftentimes office visits are rushed, and so kind of going back to that white coat hypertension, when they're rushed and you're having a lot of anxiety. Sorry for these extra little sounds and things like that. You know, and so that's what causes white coat hypertension, and we want to make sure that we know exactly what it is. So as patients, we're partners with our healthcare providers, and although we really rely on them for other things, we specifically would rely on them to help guide us with our medical decision making. However, ultimately, the ownership is in our hands as patients. And so lastly, you know, taking our blood pressure at home gives us such good information, and it can absolutely delay or prevent a major cardiovascular event. And when you do take your blood pressure at home, you want to make sure that your machine is calibrated. And one way that you can check to make sure that it's a valid blood pressure reading is that you check and you make sure that the size of the cuff fits. You can even take it into your doctor's office and have them compare it with some of the numbers that they have to make sure that it's reading correctly. Moving on to this next slide, I really love this slide. I think it does a great job at really showing the correct way for a person to take their blood pressure at home. It's a really good example. And so kind of starting from the top and working our way around clockwise, we'll just first note that you don't want to talk. You want to make sure that you are quiet while you're taking your blood pressure. Studies even show that talking while you're taking it can cause your reading to go up about 10 millimeters mercury. You also want to make sure that you empty your bladder first. So, you know, make sure before you sit down and you take it that you've already taken a bathroom break. It's important to note that position matters. We want to make sure that we're sitting in a chair or whatever seat we're in, that it allows us to have a good back support, about 90 degrees, about a 90-degree angle is what our positioning should be. You want to make sure that your feet are flat on the floor, and that your arm is supported at heart level, whichever arm it is. Another thing we want to look at is we want to make sure that prior to taking our blood pressure that we haven't smoked, we haven't had any extensive exercise, no drinking of coffee or alcoholic beverages. If we can prevent doing any of those things about 30 minutes before checking our blood pressure, that will make sure we have a more accurate reading as well. And as much as possible, while we're checking our blood pressure or having it checked for us, make sure that we're relaxed and that we've hopefully had a time to kind of just sit in a relaxed state for about 5 minutes. And I'll also lastly just note that when you do check it, you want to make sure that you take 2 readings, at least 1 minute apart. just to make sure that the number is accurate and correct. And lastly, make sure that you share your readings with your doctor. They'll be happy to know that you are checking it at home. And so that's it for me for the most part, Chelsea.
Yes, thank you so much, Samantha, for covering that. You covered such a big quantity of information for us this evening, yes. And love that you ended on this great slide. Talking about how we can be empowered to take our blood pressure at home, knowing that we're in the right position, and making sure we're preparing ourselves correctly, and also making sure to write down your blood pressure numbers to share with your healthcare team. I think that's a really great way that Samantha mentioned that we are partners in our health plans with your healthcare team. So sharing these numbers with them helps them also see your progress and make any adjustments to your plans with you. So I'm going to go ahead and jump forward. We've been getting some questions through the chat box, and go ahead and ask a few of those now. I know that we don't want to go too long this evening, but we definitely want to answer some of the questions that have come through. The first one that came up is, how does salt affect my blood pressure?
Oh, yes. So salt definitely will increase your blood pressure. So you definitely want to make sure that you are on a low salt diet, and that's for all of us. And that isn't even in terms of eating salty chips, eating high processed foods, like foods that are packaged. Salt causes your blood pressure to increase. And so your doctor is always going to tell you low salt diet.
Yes, absolutely. We know that salt definitely has an effect on that blood pressure and just overall diet for sure.
Right.
The next question we had pop up, is there an information link for the pain in the legs and the arms? And yes, we can send that out. Excited to say that we are able to send out a follow-up email to all the registrants from this evening. So we will send up some follow-up information out to all of you, to add through and highlight some of the points that Samantha has covered for you this evening, and we'll make sure to include that, include a pertinent link on that. Last question, and Samantha, this might be something that this individual might be great to have them talk specifically to their healthcare provider about. So no worries if I put you on the spot here, it's okay. But great question. Will the result of being an amputee result in a trend of lower or higher blood pressure?
That's kind of a general question. No, honestly, not necessarily. Not because I'm not sure if the person said that they were a double amputee or even one amputee, but no. So just because if you are an amputee and you lose a certain portion of your leg, you still have blood vessels circulating throughout the rest of your body, right? The remaining portion of your body. And so that doesn't affect your blood pressure one way or over the other. It could be possible that whatever caused you to be an amputee, right? Like maybe some type of car accident, or if it's diabetes, then that condition itself would have an impact. But no, not losing a limb would not affect your blood pressure.
Great, thank you, Samantha.
Of course.
One final question, and this can wrap up, the end of this. I think it's a really great one, is, what are the best steps moving forward after, learning all of this information this evening? What are the best steps that you can take for your health and around blood pressure?
So the best steps you can take is kind of what we mentioned in the last portion of the webinar, and that's checking your blood pressure at home, knowing what your baseline is, so that if you're at your doctor's office and you're having different readings from what you're having at home, we want to know what is the most accurate reading, because we don't want to prescribe you anything if that's not your baseline. And we don't want to not prescribe you anything if that's not your baseline. And so it's extremely helpful information. And it was so interesting. I was talking with a friend the other day in regards to blood pressure, and he referenced that blood pressure was kind of like it reminded him, as we were talking, it reminded him of checking your engine on your car. And I'm like, that's exactly what it's like. And so checking your blood pressure is similar to doing a tune-up. You want to make sure that everything is running right. And depending on how you're feeling, that it's in line with exactly how you're feeling. It's definitely, you want to check it more often than you would do a tune-up on a car. You want to check it daily if you can. And at least consistently for a while, every now and then, if you can check it consistently for 3 to 4 days, just to make sure that this is your baseline and you're not having any varying numbers, then it's always good. And then lastly, I'll just say, if you are having any signs and symptoms that you don't normally feel, it's always good to often just check your blood pressure and see if it's related to that, right? If you're having symptoms like dizziness or nausea and it's kind of consistent, then you should check it to see if it's related to that.
Great. Well, thank you so much, Samantha, for being here tonight with us and sharing your knowledge and those great parting words with us. I'll just give a final thank you, for our partnership with the San Diego Black Nurses Association to bring this this discussion to life this evening, and also a final shout out to San Diego Gas and Electric for supporting this and bringing this to us locally. So thank you very much to everyone who joined this evening, and we will be sending some follow-up information. If you want to look into this further, I urge you to explore heart.org. There's a lot of great resources there, and some resources we'll be sending out as a follow-up. So thank you very much, and happy Heart Month to everyone.
Yes.